Hi, everyone. We'll be starting just very shortly. We're going to give people a little bit more time to join. We'll be back in just a moment. Good afternoon, everyone. My name is Lisa Uris, physical therapist and regional director at Sphere Physical and Occupational Therapy. I'd like to welcome back those of you who have attended one of our other webinars, as well as welcome those who are joining for the first time. Thank you all for choosing to spend the next hour or so with us. We appreciate you taking the time out to learn with us today. For those of you who don't know who we are, Sphere is a private outpatient practice that has been around for over 20 years, but currently 20 locations in the New York City metro area. We have continued to offer in-person care throughout COVID-19 pandemic, and we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone within our clinics. For detailed information on the safety measures we're taking, please visit our website at spherecenter.com. We've also launched Sphere Live for those who are looking to stay in and receive care from the comfort of their own home. This gives you the opportunity to receive physical or occupational therapy treatment through our telehealth platform from any device. We're here for you in whichever way makes you feel most comfortable. If you're looking for individualized care, please reach out to us at your convenience and we'll get you set up for an appointment right away. We're here with you today because since the COVID-19 pandemic started, we know there are a lot of people who do not have normal access to providers for in-person care, and at the same time have a bunch of unanswered questions about pelvic floor health and function. Our team of clinicians got together and are collaborating today to provide you all with educational information and to answer frequently asked questions that you may have that you may not be able to find answers to before this. So we created today's talk specifically for you, and we're coming to you live from our own homes. We do not anticipate any technical issues, but please bear with us if we do have any as we navigate through some of this new technology. As part of our session, we will be talking through and demonstrating some exercises and stretches, and we really look forward to you following along as you can and can participate. I promise you this will not be your typical Zoom meeting. Please note that if you are experiencing any pain or symptoms while performing any exercises or stretches that we talked about today, that you stop and reach out to us directly so we can support you. So let's go through some housekeeping stuff. Throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know in the Q&A feature. I want to take a moment to show you where the Q&A feature is. So if you look at the bottom, if you're on our webinar, you look at the bottom of your screen, you're going to see a Q&A feature here. So you go down, you're going to let it pop up. You're going to say Q&A. That's where we want you to put your questions. So make sure that if you have anything come up, you have any questions about what people are talking about, you put it in the Q&A option so we can make sure we get to it throughout the webinar. For those of you who are watching through YouTube Live, we are also monitoring the comment section there as well. So please feel free to type your questions in there and we'll get to them as best as we can. All right, great. So let's talk about our goals for the day and what we'll be covering throughout the webinar. So we're going to review the basic anatomy and function of the pelvic floor. We're also going to learn the do's and don'ts for healthy bathroom habits and bust common myths that you might have heard before and answer some frequently asked questions. We'll also demonstrate some stretches that you can do at home to address certain conditions, and we'll leave time at the end for you to ask us questions and to get to some of that Q&A stuff. All right, awesome. So before we get started, I'd like to introduce you to our team of panelists. We're going to welcome everyone onto the screen now. So first, we have Devon Dinegar. Welcome, Devon. She is a pelvic health physical therapist from our Brooklyn Heights location. Next, we have Jessie Weinberg, who's a physical therapist at our Broad Street office in Financial District and the Pelvic Health Program Director as well. And then lastly, we have Nicole Siraj with us, who is a physical therapist and clinical director at our Brooklyn Heights office. She's going to be helping us answer some of the Q&A questions today. Welcome, team. Thank you for joining. Good to see you all. All right, perfect. So Devon, Nicole, and I are going to say goodbye for now. Jessie, we're going to let you take it away with some information on anatomy.
All right, thank you. Okay, so we are going to start with some pelvic floor anatomy. So the pelvic floor muscles are oriented in 3 layers, from most superficial outside to deep inside. So the superficial muscles are the muscles that are in the top left corner here, the one on the diagonal, and then this other muscle here that's on the horizontal, so you can see in the top left corner. And these muscles are really important for closing the vaginal opening, as well as other sexual function. Layer 2 muscles are on the upper right side of your screen here, and those are in charge of a lot of our sphincters, as well as our urinary function. And then the deep pelvic floor muscles are in the back there surrounding the anus, and these are in charge of a lot of our bowel function, as well as some support. So as a whole, our pelvic floor muscles are in charge of our bowel, bladder, and sexual functions, as well as acting as a support for the pelvic organs that sit inside. So the first picture that we pulled up here is the female anatomy, but if we go to the next slide here, you will see that men also have pelvic floor muscles, and it looks actually pretty similar to the female anatomy. So that top layer there with the muscles on the angle as well as in the horizontal, those muscles are in charge of a lot of urinary function as well as sexual function. And then the muscles that are deeper surrounding the anus, those are in charge of support as well as some of the bowel function there. So that's your basic anatomy review. Next, we're going to bring Devon on to talk about the two main categories of dysfunction.
Right. Thanks, Jessie, for that nice anatomy review. It's always very helpful. So I want to talk to you guys today about the two main classifications of the pelvic floor muscles, those being hypertonic and hypotonic. So hypertonic means that your muscles have more tone and are more overactive and that they contract too much and or too frequently. So hypotonic, on the other hand, does mean that your muscles have less tone and might be underactive. So let's talk about how these two types of muscle classifications might present. So muscles that are hypertonic may cause tightness, pain, tenderness, and bladder and bowel dysfunction. Stress has also been shown to directly affect the pelvic floor hypertonicity, although sometimes there's no cause at all, but that doesn't mean it has to be forever. A common misconception is that overactive muscles are strong muscles, which is just not the case. So I always like to relate it back to the bicep because you can always see your bicep, as unlike the pelvic floor. So in order for your pelvic floor or your bicep or your pelvic floor to work appropriately, your muscles have to be at their full capacity. If they're a little bit more hypertonic, a little shorter, and you try to squeeze, it's not going to be as strong and you're not going to get that same sense of strength. So we definitely want to make sure that your muscles are nice and lengthened before we go into strengthening, but we'll definitely talk about that throughout the webinar today. On the other side of that, hypotonic muscles, which have less tone, are often weak as well. And that most commonly leads to urinary and bowel incontinence. However, hypotonic muscles can also be painful, and we typically see that in women after having a baby. So that's a little brief intro into the two types of muscle classifications. Now we'll go through our most commonly asked questions. So first we'll start with bladder questions, then we'll move to bowel and then sexual health. So let's bring Jessie back on so we can get started.
All right, thanks, Devon.
Awesome.
Let's get started with these questions.
Do it. All right, so I have the first question. So Jessie, I notice I go to the bathroom more often than my friends. What's that about?
Devon, that's a great question. I'd actually like to start this off with a poll. So we're going to pull up a poll here. How often do you think you should be urinating? Every 1 to 2 hours, every 3 to 4 hours, or every 4+ hours? So you guys can vote on this poll here and we'll see how it goes. Give it a few more minutes to load here. Every 3 to 4 hours was the most common answer. Some of you said every 1 to 2 hours, and some said every 4+ hours. So you guys are right on the money there. You should be going to the bathroom about every 3 to 4 hours. If you're going a lot more frequently than that, this could be a sign of pelvic floor dysfunction. Perhaps you're always drinking water. I get a lot of patients who say, oh, well, I'm always drinking water. But if you're constantly looking for the bathroom, it probably means that you're going more frequently than you should. So as we said, the norms are about every 3 to 4 hours, and your urine stream should be strong and at least 8 seconds long, probably longer than 8 seconds. If you have the constant urge to go to the bathroom, you may actually have a little bit of that hypertonicity or tightness in your pelvic floor muscles. It would be helpful to stretch your pelvic floor as well as the muscles attached to the pelvis. We're going to demonstrate some of these exercises at the end, as well as perform some behavioral modifications. So behavioral modifications may include trying to increase that amount of time in between each time you go to the bathroom. So those would be my top suggestions there.
Great. Thanks, Jessie. That's really helpful. Let's move on to the next question. So I gave birth about a year ago, and I'm still noticing I leak urine when I sneeze and when I work out. Is this normal? Will this ever go away? What can I do about it?
Great question, Devon. So what you're experiencing here is called stress urinary incontinence. So this means that when the muscles are under physical stress, like sneezing, coughing, laughing, or jumping, you have some leakage of urine. So this is really common after pregnancy and childbirth, but this isn't just a part of being postpartum forever, right? You should not be experiencing this forever after giving birth. So the most direct exercise you can perform to help strengthen the pelvic floor is called a Kegel. Kegels are a pelvic floor muscle exercise in which you draw up and in your pelvic floor muscles and hold. So my favorite visual cue is to draw up and in like you're picking up a blueberry, not only because I like blueberries, but I think it's kind of a fun image that you can think about when you're doing a pelvic floor contraction. So you should work on holding this contraction and then quickly contracting and relaxing your pelvic floor. It's also important that if you're experiencing these symptoms, especially when working out, that you strengthen the other muscles that surround the pelvis, including the glutes and the core, because they need to be strong enough to be doing their jobs as well. If you're confused about doing a Kegel or think that you might not be doing right, it may be best for you to get some guidance and supervision with a PT.
Also, if you have any pain with Kegels, that's definitely a red flag.
Oh, yeah. Good point, Devon. If you're having pain with Kegels, it probably means that they're not something that you should be doing, and you should definitely get evaluated.
Sure. Thank you. That's awesome.
All right, so I have the next question here, and it's definitely currently relevant. So the next question here is, I'm worried about getting COVID at a public restroom. Should I be squatting over the toilet?
Great question. So COVID or no COVID, don't squat, don't hover, you want to sit. You want to let those pelvic floor muscles relax. When you're urinating and defecating, your pelvic floor muscles have to be completely turned off in order for your bladder and bowel to contract and fully empty. By squatting over the toilet, your pelvic floor muscles are obviously still holding on and they're not able to fully relax. So you might notice that your urine stream sprays a little bit when you are hovering, and that's a clear sign that your pelvic floor muscles are definitely not shut off all the way. Your urine stream should be straight and smooth, and there shouldn't be any craziness happening. But if you are worried about contracting diseases while sitting on a toilet seat, know that it's highly unlikely, but I'd rather you err on the side of caution and put toilet paper down if that makes you comfortable, but I'd rather you do that over hovering or squatting. So do your pelvic floor muscles a favor and don't squat.
Yeah, I've gotten that question so many times, and I feel like time and time again, I'm always telling people, don't squat over the toilet.
Nope.
You know. Anyway, here's our next question. I heard it was bad to hold in pee, so I go whenever I get the chance. Even if only a few drops come out, should I still do this?
So that's a great question. So I really want to see what the audience does. So if you could please answer this poll on your screen. Do you go to the bathroom just in case? For example, before leaving anywhere, before meetings, when you're nervous, when you walk by a bathroom, etc. So yes, no, or sometimes. Okay. Yes. Uh-oh. So Jesse, you are definitely not alone. 51% of the audience has a case of just in case urination. So what that means is you're not allowing your bladder the chance to fully fill. And that's not great. Your bladder is meant to fill. So you're creating a lower tolerance for your bladder's capacity to hold urine the more you go to the bathroom, the more frequently you go to the bathroom. So ideally, we should all be able to hold urine for about 3 to 4 hours, as we talked about earlier. And you just want to make sure that you can get there. And that might take some time. So that's some bladder retraining tips that you can definitely work with a pelvic floor physical therapist with, or just trying to delay your voiding by 5 to 10 minutes to start and slowly increasing that over time. But just definitely not giving into that first sense of urgency. You want to make sure that your urge is moderate to strong before giving in, or at least closer to that 3-hour mark too, if you're at that point already. So
yeah, I feel like we've always learned too, like, oh, go to the bathroom before you leave the house, or go to the bathroom before your meeting, and it's not good. We don't want to be doing that.
I know, we just grow up thinking that this is normal, and it's definitely not. And it's also good to note too that even if you do go to the bathroom after 5 minutes of going, urine will come out. Your bladder always is filled with urine, and that's totally normal, but we want to make sure that your bladder continues to fill with urine over the course of those 3 hours. So just make sure you're giving yourself plenty of time and not giving in and not letting your bladder control your life.
Right.
So, all right, now we're going to move into some bowel questions. So I'm going to start with the first question. So Jessie, I've been struggling with constipation my whole life, and I've only had really hard bowel movements every 3 days. Any suggestions?
Yes. So Devon, constipation is something that a lot of people struggle with. The norm for bowel movements is as frequent as 3 times a day and as infrequent as every 3 days. If you're feeling constipated when you go every 3 days, there's certainly some modifications that you can make, especially if your stools are feeling really hard and painful to pass. So the first thing that you can do is change mechanically the way that your body is set up. So one way that we can do this is raising the feet up so that you're in more of a squat position while you're sitting on the toilet. So you want to increase that angle between your hips and your pelvis. This helps align your hips and pelvis so that one of the deep pelvic floor muscles called the puborectalis, muscle that wraps around the rectum, it'll loosen to create space for the stool to pass through. So that's one suggestion there. The next is about dietary changes. And let me just make a disclaimer here right now. If you have any restrictions in your diet, if you have anything going on metabolically or something where you have to consult with a GI or a nutritionist, please do so before taking any of this advice. This is more so general recommendations. And if you have any restrictions, please consult with someone first. So one thing that we talk about with having a healthy diet is fiber. And I think we all know about fiber, right? But I think a lot of the time when we think about fiber, we think about insoluble fiber, which are those leafy greens or roughage that kind of help sweep things along the colon. And while this is really good for us, it can also cause some gas and bloating. And insoluble fiber isn't the only thing that we want to include. The other thing is soluble fiber. And this kind of helps the stool move smoothly through the colon. And so some examples of these are chia seeds, flax seeds, avocados, pears, oatmeal, and this kind of helps the stool pass through. The last thing is maybe getting into a morning bowel routine. So the morning is the best time to go. You have the greatest peristalsis movement of the day. And peristalsis is basically just this rhythmic motion of your digestive system that helps propel things through your body. So you kind of want to roll with that, right? So if the time that it's the highest is in the morning, you want to try to do whatever you can to have your bowel movement in the morning as well. So a few things that you can do to stimulate this is have a hot drink, whether that's coffee, tea. A lot of my patients say also that they have, their bowel movement right after they have their cup of coffee. It's not a coincidence. It does actually help to stimulate the colon. So you have your hot drink. Once you feel the urge to go, definitely go sit on the toilet. And we talked about propping your feet up on a stool. So be in a relaxed position with a better angle of your hips and pelvis. Then I want you to breathe. And the way I want you to breathe is through diaphragmatic breathing. And what this is basically belly breathing. So you're going to breathe in, your belly expands, your pelvic floor expands and relax. And then just exhale. So you're trying to relax your pelvic floor here through the breath. And this will help the stool to kind of come down or descend. And then if you're on the toilet for more than 10 minutes, time to get off. So try that for 10 minutes. And if it's just not coming, then you want to get off the toilet. And those are my biggest suggestions. So
Jessie, you didn't mention pushing at all. You didn't mention straining, pushing.
That's right, Devon. We do not want to be pushing and straining when we're having a bowel movement, right? So if you're the person that's like grabbing onto the wall or red in the face, right, it probably means that you're pushing too much and you're not actually relaxing your pelvic floor.
That's super helpful. Thank you. All right, let's move on to the next question. So every time I sneeze, I pass gas. Is there anything I can do to fix this? It's kind of embarrassing.
Yeah, Devon, great question. This actually happens a lot more often than you think. So this question is very similar to the question about stress incontinence, except it's gas that's escaping and not urine. So what this is indicating is that we likely need to strengthen the posterior pelvic floor muscles. And these are the muscles in the back of the pelvic floor surrounding the anus. We have a few techniques that you can try out. So the first one is called quick flicks. So we'll be doing that Kegel exercise we talked about before. And when we talk about the quick flicks, we're trying to get a quick contraction and a quick relaxation. So we're doing these multiple times in a row super important though that not only are you squeezing your pelvic floor, but also relaxing your pelvic floor. This helps to recruit the pelvic floor muscles when we're feeling that gas might try to escape, but we have to quickly stop that from happening. The next one is working on the external anal sphincter contraction. So this is a little bit harder to isolate. The external anal sphincter is the muscle that surrounds the anus, and that's part of your pelvic floor. It is hard to isolate from the rest of your pelvic floor, but just by focusing on that posterior compartment or the muscles in the back of the pelvis will help to recruit those muscles a little bit better. This will help you shut when you're trying to hold back gas. And then lastly, for the long-term solution, we're going to be working on long holds. So getting your Kegel, holding that contraction for about 20 seconds or so to help with endurance. So this will help you to hold that gas until you find an appropriate time and place to pass it.
Perfect. That's really helpful. Thank you.
Yeah. I have our next question here. So the next question is, I feel like I always have to rush to the bathroom to have a bowel movement. Is this normal?
So Jessie, depending on your stool consistency, this may be a normal response. So when stool is liquidy, urgency is inevitable because your external anal sphincter is not made to hold in liquid. It's made to hold in solids. So if you're constantly having diarrhea or softer stool that's making it hard to hold in, we want you to see a gastroenterologist to understand what's going on and why that is. On the other hand of that, if you're experiencing urgency with all types of bowel movements, including solids, this is not normal. So your external anal sphincter and surrounding pelvic floor muscles should be strong enough and coordinated enough to give you some time to get to the bathroom without rushing. So we do have some strategies for you today. So in the moment of that urgency, we want you to try some Kegels or those short, quick flick pelvic floor contractions that Jessie just mentioned. And you're going to try to walk slowly to the bathroom. You're going to try to stay as relaxed as possible, breathing deeply through your belly. Please don't rush. It's going to increase the urgency and it's going to make it a lot more difficult. Of course, this is easier said than done, so it might not happen overnight or in one try, but these are things that we want you to start to try. In the long term, though, outside of those urgent moments, we want you to practice Kegels, and specifically those posterior Kegels, where you're having that more external anal sphincter focus. And you're going to do those for long holds. You can start with 5 to 10 seconds and then work your way up to about 30 seconds several times a day. But you can definitely work with a pelvic floor therapist here as well to give you a more individualized program of what would work best for you.
Yeah, perfect. I know, Devon, I've gotten this question quite a few times, and I feel like this symptom is one of the ones that's like really anxiety provoking and alarming. So I think that by having these strategies to focus on, patients can really feel a lot more calm, right? Which then, like you explained, makes them feel a lot more comfortable, you know, not as.
Of course, it's a very stressful situation. So you want to make sure that you're able to get there, but you also don't want to have your life controlled by your bowel movements. So
right, exactly.
It takes time, but it's possible.
Yeah. All right, we're going to move on to our next set of questions. We have a few miscellaneous questions that didn't really fit into any category that we wanted to talk about to answer before diving into any of the sexual health questions. So we're going to get right to that. Our next question is, do men have pelvic floor dysfunction, and what type of symptoms do they typically experience?
Yeah, so as you mentioned in the anatomy review, Jessie, men do have pelvic floors, and therefore they have the potential to develop pelvic floor dysfunctions. So typically men experience pain, whether that's pelvic pain, testicular pain, penile, or groin pain. But men can also experience premature ejaculation, erectile dysfunction, and urinary and bowel incontinence. So they're really susceptible to all these things too, unfortunately, but they can definitely be worked on.
I think people are shocked to know that men have pelvic floor because we always talk about pelvic floor in the context of women and a lot of times like related to having babies. So I think it's really important to note that men also do have pelvic floors.
Totally agree. All right, let's move on to the next question. So Jessie, sometimes I experience heaviness or pressure at the entrance of my vagina, and I feel it when wiping. What is this? Do I need surgery? Should I be concerned?
Great question. So I think that this symptom, like kind of what we just talked about with that fecal urgency question, these symptoms also are incredibly alarming. So this is a typical sign for pelvic organ prolapse. A pelvic organ prolapse is when one of the organs of your pelvis, either the bladder, uterus, or rectum, typically, descends down into the vaginal wall. So we grade prolapse from a grade 1 to a grade 4, and that's in severity from mild to most severe. So a grade 1 is a minor descent of that organ into the vaginal wall. Grade 2 is a descent to the vaginal opening. Grade 3 is a little bit past the vaginal opening, and grade 4 is a little further past the vaginal opening. So prolapse is very common, especially amongst women who've given birth or been pregnant, and sometimes in older adults as well. Depending on the severity, it can be very treatable with pelvic PT alone and no surgery required. If your prolapse is a grade that does not require surgery, the method to treat it would be doing pelvic floor strengthening, so the Kegels that we mentioned, as well as glute and core strengthening. If you feel like you have a prolapse, it probably would be best to make an appointment with either a pelvic floor physical therapist, your urologist, urogynecologist, OB, someone who is trained to assess for prolapse to see what kind of grade you might have, as well as learn the most appropriate interventions.
Great. It's also not always super common that OBs check this at 6 weeks. So if you're aware of it, it's always a good thing to ask during that checkup just to see where you're at, if any. Everyone's trained in this that works within this field. So
yeah, great point, Devon.
Really cool. Thanks. All right. So next question. I'm currently pregnant and want to prepare my body for labor and delivery. Do you have any suggestions?
Yes, it's a great idea to prepare your body and get physical therapy before giving birth. So during the first 2 trimesters, we typically focus on strengthening the Lumbo-Pelvic Complex, and I'll explain what that is. So due to the presence of a hormone called relaxin in your body, many of the joints in your body become a little bit more loosey-goosey. And one of those joints that's highly affected by relaxin is the sacroiliac joint, or this joint right here. So the sacrum and the 2 ilium here. And as you can see here, the ligaments that connect these structures become a little bit looser during pregnancy. And because this joint is highly reliant on ligamentous stability, we want to make sure that we're strengthening the muscles surrounding that area appropriately. So during the first 2 trimesters, we typically focus on strengthening to help alleviate those aches and pains due to the relaxin, as well as keep you feeling as mobile and as strong as possible. One common misconception that I'd like to address is that you should be doing Kegels to strengthen your pelvic floor, especially closer to your due date. Although Kegels are helpful to strengthen the pelvic floor, it's so important that during the 3rd trimester, you're focusing on relaxing your pelvic floor muscles. By relaxing your pelvic floor muscles, you're preparing the baby to descend and be delivered vaginally. If your pelvic floor is really tight, it's going to be hard to kind of let go and allow this to happen. You can also work with a pelvic floor PT to learn more about diaphragmatic breathing, which we talked about earlier, right? Relaxing the pelvic floor and allowing it to expand, as well as perineal stretching. The perineum is the tissue between the vagina and the anus. So we work on stretching and mobilization to help the tissue become more mobile and reduce the risk of tearing during pregnancy.
Awesome.
So next, we're going to move on to our questions about sexual health. Our first question in this category is, I'm a young female and haven't had any kids yet. I notice pain in my vagina when I try to have penetrative sex. My doctor said to relax and have a glass of wine, but it didn't get better. Is there anything else I can do?
Yeah, Jessie, that's a great question. And you're definitely not alone in these symptoms. So before I answer that, I want to know what the audience thinks by answering this poll. So on average, what % of women do you think report pain with intercourse? 5%, 10%, 25%, or 75%? All right, let's see. 25%. That's what I would have thought too. Unfortunately, it is slightly higher than that. According to the American College of Obstetrics and Gynecology, 3 out of 4 women, so 75% of women experience pain with intercourse at some point in their life. So that's not great, but there's definitely things that we can do to help that. So Jessie, to get back to your question, it's likely you're having pain with penetration because your muscles are hypertonic or too overactive. So unfortunately, it's going to take a bit more than a glass of wine to relax them, although that would be pretty awesome. There are a variety of stretches that can be performed daily to facilitate this pelvic floor relaxation. We'll demonstrate a couple of stretches in a few minutes, so please stay tuned. There's also devices called vaginal dilators that can help you to reduce pain with penetration via the vaginal canal. And this is just a series of inserts that you can purchase, and they're just stretched out the pelvic floor in a way that's comfortable for you. It's definitely a little intimidating sometimes, so feel comfortable and feel free to seek out a pelvic floor physical therapist to help you through this unique treatment.
Yeah, great. Yeah, we'll talk more about those stretches in a few minutes. We're gonna demonstrate some.
Stay tuned.
The next question here is, I've been having penile and testicular pain with erection and ejaculation. My urologist said it's not my prostate. So what's going on?
So Jesse, every time that I do get this question in the clinic, the first thing I always say is, thank goodness that you got this checked out by your urologist or a doctor. Just ruling out that prostate is such a huge step in knowing what's going on. So unfortunately, you're still having the pain and it's maybe frustrating, but it's likely caused by these overactive or hypertonic pelvic floor muscles, which, like we talked about earlier, often occur spontaneously or without cause. And as mentioned earlier, stress can be a very significant leading factor in why you have hypertonic muscles, although it's not always the main cause or the only cause. So it's always suggested to recognize triggers in your life and to find a stress relieving method that works best for you. So that might be yoga, meditation, reading, the list goes on and on. Everyone's a little bit different. Specifically with intercourse though, for the male pelvic floor, during ejaculation, these pelvic muscles go into spasm. And in someone with hypertonic pelvic floor muscles where they're already a little too tense, it's just going to continue to feed into that cycle. And that could last for minutes, several hours, several days after a single ejaculation. So that's definitely, not the best. And to reduce pain, we suggest stretching the pelvic floor like we would for any hypertonic muscle. Doesn't have to always just be this pain with intercourse or after orgasm or ejaculation. So Jesse, would you mind walking us through some stretches? And I'm going to set up my space here, but hopefully the audience has a little bit of room to follow along our favorite stretches with us.
Yeah, let's do it. So Devon is going to be demonstrating the exercises and I'll be talking through them. So the first one we're going to start with, you're going to be laying on your back. This one's called Happy Baby. So this is to help relax the pelvic floor muscles and stretch some of the surrounding musculature. So you're going to start on your back. Your knees are going to go in towards your shoulders. Good. You're going to place your elbows on the inside of your knees and your hands on the outside of either your feet or your ankles. And you're going to basically stretch in this position here. You could rock back and forward as Devon, or side to side as Devon's kind of showing here. And you should feel a really nice stretch in the pelvic floor as well as the inner thighs. I typically like to hold this one for about 30 seconds and do 5 repetitions.
If this is a little too much for you, you can always hold your knees and just do that same stretch. It's not going to be as intense. It's going to be a little easier for you if you're having trouble getting this motion.
Right. And throughout this whole stretch, we're really focusing on breathing into the belly and breathing down into the pelvic floor. All right, I think we're going to move on to the next exercise, which is called cat-cow. We're going to be on hands and knees. So the first one, we're working on this to mobilize the lumbo-pelvic spine. This is a great exercise to coordinate your breathing with your motion, as well as some relaxation and activation. So the first thing that you're going to do is you're going to drop your belly, stick out your tush, look up and breathe in. Good. And then you're going to exhale, round your spine and drop your head, pulling your tummy in. Let's do 5 repetitions. So again, drop the belly, stick out the tush, look up and breathe in. And then exhale, round your spine, drop your head, tuck your pelvis. Good. And inhale and look up. And exhale and down. I believe that was number 3. Inhale, look up. Not the best at counting. Exhale and round. And one more. Good. And exhale. And so some of you guys might not have as much range of motion as Devon does. She's got some pretty great range of motion.
I've been practicing, Jesse.
Yeah, you should go through your pain-free range of motion. So whatever that is for you, do that. It doesn't have to be as much as Devon. And then our last one here we're gonna do is a deep squat stretch against the wall. So Devon is going to place her back against the wall and basically just slide down into a comfortable squat. Good. So here you can either be sitting on the ground or hovering in a relaxed position, so a really deep squat. If you're feeling like holding that position is really strenuous, you can put a pillow underneath your sits bones there to help prop you up. So this, you can also do it much higher than Devon is. This should help make the squat a little bit more achievable and comfortable for you.
It always feel very
also like to hold for about 30 seconds, maybe 5 times. But if you feel like doing a prolonged hold, I would do about 2 minutes.
And the wall is nice just as a back support, but it's not always necessary if you have that range. So yeah. For me, I need the wall. It's not as flexible as I wish I was.
I like the modification with the wall, though. It does make it feel a little bit more relaxed.
I agree.
All right, I think we got 2 more questions for you guys, and then we'll get into our Q&A portion.
Great. All right, now that I'm all loosened up, thank you, Jessie. So Jessie, since menopause, I'm having vaginal dryness and pain with sex. Is that what my sex life is going to look like from now on?
No, it's not. So after menopause, there is a decrease in your estrogen levels. So vaginal dryness is one side effect, but that doesn't mean that you can't enjoy sex. One important consideration is the use of lubricants. So I usually recommend lubricants that are gentle, water-based, and are paraben-free and glycerin-free. You can also use some at-home lubricants, including coconut oil or even olive oil. Yeah, I know, you could get creative, you know, it's fun. Another reason sex can be painful is because the pelvic floor muscles have atrophied or thinned since menopause. So doing pelvic floor contractions can help bring blood flow to the area and plump the tissue a little bit. This can reduce discomfort that you're experiencing on the external tissue or internal tissue during penetration. Another reason you can be having pain is that your pelvic floor muscles are just a little bit having some tightness. So because you can kind of fall on either end of the spectrum there, I would certainly recommend that you see a pelvic floor physical therapist to determine which category you may fit into before really starting any interventions on your own.
Great. All right. So last question here, Jessie. Since having a baby, sex doesn't feel the same. I'm noticing a diminished sensation and difficulty achieving orgasm. Why is this happening, and what can I do to improve my sexual experience?
So this happens quite often after pregnancy and childbirth. I would say the answer to this question depends on how long after birth you're feeling this way. So within the first 6 to 8 weeks after childbirth, there's a lot of stuff going on and a lot of healing that's happening on its own. So after 8 weeks, you can start to think about doing something about this. During childbirth, the tissue and the muscles stretch and sometimes tear. And because the muscles have torn or basically are stretched or injured, right, it can become more difficult to feel penetrative sex as well as achieving orgasm. So during orgasm, what happens is your pelvic floor muscles have to contract and relax very quickly and in a very coordinated fashion. So if the muscles are still healing and not contracting and relaxing as efficiently, it may be a lot more difficult to achieve orgasm. And therefore, you should likely practice strengthening your pelvic floor muscles, as well as doing some of those quick contractions, right, that we talked about earlier. Again, if you're experiencing any pain or discomfort with Kegels, please reach out to a physical therapist, because this intervention might not be right for you.
Absolutely. Thank you, Jessie. So that sums up our questions. So let's bring Lisa back and we can answer some of yours. Hey, Lisa.
Hey, team. That was very informative. I really enjoyed listening to that, and the format was really helpful because those are just questions that people have all the time that they don't have answers to all the time. So very, very helpful. I've done my best to compile some of the commonly asked questions that came in through the Q&A. So we'll start to go through those. Some questions that came up were just about pelvic floor PT in general. So I thought we could just start by you guys addressing, what is a regimen, I guess short and sweet, what does a regimen typically look like? Do you need a referral? And like, how do you know like which approach to take? Like, do you need pelvic imaging? I guess, what do you guys generally recommend for people?
Yeah, you go ahead, Devon.
All right, so anyone can come to see us. You don't need a referral. We do recommend that you do have a doctor that you can refer back to, because we will need a referral after about 30 days. So that's a conversation we definitely start having right away. But you can come and see us if you have any of these symptoms that we talked about today. But typically it's pretty informative, I think, to come in and have a checkup with your pelvic floor therapist, and just get an idea of what's going on. If you are having, let's say, intense severe pain, we might recommend that you do get some imaging done. But if you're just concerned or it just started, possibly, that's always a nice place to start, is with us.
I will add, Devon, so usually during an assessment too, we'll do a thorough evaluation of the external tissue as well as an internal assessment if we feel like it's appropriate. You know, a lot of times patients will come in and they're really nervous or scared, and that's totally understandable because this is such a private, you know, thing that you're dealing with and a little scary. So I always tell my patients too that if at any point they feel uncomfortable or they want to stop the assessment, you know, just let me know. Everything that we do is up to what they feel comfortable doing, or, you know, and with their consent. So you're never going to feel like you're forced to do something. If you're afraid to take that first step and you're really experiencing some of these symptoms, we're going to meet you where you're at.
Totally. I always tell all my patients they're the boss when they're in our private space. So they're the boss everywhere, but especially
that's great.
Yeah.
Thank you, guys.
Of course.
That's awesome. Somebody asked, like, are these exercises the same if you have hyper or hypotonic muscles, or a condition of hypo or hyper? Can you just talk about the difference and maybe give people direction?
Sure. So typically hypertonic, or those like more tense muscles, will require some stretching just to make sure that you have that full length like we talked about before you get into the stretching or the strengthening, excuse me. For hypotonic, we do tend to prescribe more Kegels, but that's definitely not the best for everybody, like we talked about. So it's always good to understand where you're at by getting an assessment with a therapist.
Would you guys, speaking of Kegels, there's a couple questions about that. One was, would you recommend somebody using a biofeedback device at all? What's your opinion?
That's a good question. I think that there is certainly use for biofeedback, and I do use it at times with my patients. However, sometimes I feel like my patients got like really attached to it and they don't actually know how to do things independently. So I'll use it, but I use it sparingly. That's my own clinical personal opinion. A lot of people use it all the time and they think that it's wonderful, but that's just my own opinion.
I agree. I think the patient has to have a real understanding of what a Kegel looks like without compensations, because biofeedback will pick up a whole lot of muscles. So it's just important to know that they're doing it right and that they're doing it effectively.
Great. And if someone someone feels like when they're doing a Kegel, they're also contracting their posterior pelvic floor around the anus, is that normal or is that abnormal?
Yeah, that's totally normal. So the posterior pelvic floor is part of the pelvic floor. And it is hard to kind of differentiate the two. And that typically, if we're trying to get more anterior or front or more posterior back, will require some, you know, verbal and tactile cues from the therapist. So yeah, I would say that if you feel it just overall generally in your pelvic floor, that's totally fine.
Just as long as your glutes aren't activating as well your buttocks muscles, then you're all in the clear. Okay,
great. Can squatting strengthen the pelvic floor as well? That came up as a question.
Yeah, it can. It's certainly not directly related to this. I mean, it is directly related, but it's not direct to the pelvic floor like a Kegel is. But yeah, I always recommend that we recruit other muscles surrounding the pelvic floor at the same time as we do the pelvic floor contraction. So doing a squat, if you want to practice that plus Kegels at the same time, yeah, I would say.
Especially when someone's having some leakage with movements, like getting up from the couch. That's perfect. Incorporate both together all the time.
Great. That was actually, you guys are great jumping into my next questions and I love it. You guys are reading my mind because some questions came in about urination and leakage. And so can you touch on kind of on that, like what causes leakage at, like during certain activities or even at night, and what would someone do about it?
Yeah. You want to take it, Jessie, or?
Go ahead, Devon.
All right.
I'll add if you
Okay, cool.
want.
So with that, it's typically in a weakness issue, whether that's the muscles being a little too tense or a little too loose, or you know, underactive, underperforming. So we want to make sure that you're doing Kegels. That's ultimately the plan, but we have to make sure that you're doing that appropriately with the stretched pelvic floor.
Okay.
And as to specific times, it's best to practice within that time frame. So if it's happening right when you wake up, that's definitely very challenging. But if you can try to do some Kegels as soon as you wake up to just train the pelvic floor, like we're awake, we're on, let's go, let's get the day moving. Things like that, just kind of coordinating it to when you're feeling the most leakage or having the most insecurity about leakage. Do you have anything to add, Jessie?
I think sometimes people will experience incontinence because they may have a prolapse. Now, don't freak out, everyone. It may just be, like minor. And again, even if you do have a minor prolapse, we do the same exact thing as we would if you had incontinence without prolapse. So strengthening the pelvic floor muscles when you're doing those specific activities, getting up from a chair, standing up from the ground or whatever it is.
Awesome. Another question that came in is when urinating, when actually going, what causes an stream or a delay in being able to go easily? Things like feeling like when you sit down, it takes a little while to go, or things like feeling like, hey, I went a little bit and then it stops, but then I still feel like I still have to go. And when I go, it feels like I didn't go at all. What can you guys touch upon that stuff?
Yeah, so that really ties into the hypertonic muscles, where muscles are a little bit more tense than we would like them to be. So those stretches are going to be very helpful. Deep breathing, same things as having an effective bowel movement, basically apply to having a good urination, a complete urination. So again,
essentially, yeah.
But,
go ahead.
No, go ahead. You're good.
I was just going to say, essentially, your pelvic floor isn't letting go when you're about to urinate. So one thing that I found really helpful for my patients is that they do one of those deep breaths. They inhale, relax their pelvic floor, and on the exhale, they start their urine stream. And one thing to note too is that you should not be pushing out your urine. You should just let it come out, and then it's kind of like you release, you're done, and then kind of move on with your day.
So can you guys speak to, like you mentioned it a little bit, like going frequently at night? What's the issue? Or maybe if it's very particular to each individual, that's fine. But what could be causing increased feeling of going only at night? And then when you do go, you feel like you have to go a lot, and then you go and not much comes out. Can you speak to that kind of nighttime issue?
Yeah, sure. I'll take this one, Devon. So going at nighttime is really common. It's called nocturia. It's like a clinical term. And if you feel like you're waking up multiple times during the night, there's a couple of things that you can try. Number one is actually just going once before you go to bed. A lot of times people feel like they have to make multiple trips. And this is more of this like anxiety feeling that, oh, I'm going to have to go multiple times at night. Let me just like go 4 times before I go to bed. No, you want to go one time. Another thing you can do is modify your fluid intake. You want to be drinking a lot throughout the day, and then stop maybe about 2 hours before bed. So don't drink a whole water bottle before you go to sleep. Don't have the water at your nightstand if you think you're going to really drink a lot. So limit your water intake, as well as no teas, no seltzers. Wine is a bladder irritant. So there are things that you can cut out. A lot of this is like case by case, but a lot of things that you can cut out before bed or 2 hours before bed that do aggravate the bladder and make you have to go quite a lot at nighttime.
It's also worth noting, though, that you are waking up because you have to urinate, not you're just already awake and you have the sense to go. Because it's definitely harder during nighttime to turn off that urge because there's nothing distracting you. There's not life going on. So just being aware if you're a light sleeper or if you're just having trouble sleeping, that could be a little bit different than waking up with an urge to urinate.
Great, thank you guys. Okay, on a different topic, somebody with diastasis recti, can it be healed with exercise? Can it close completely on its own? And if so, how long would that take? How do we address that with PT, or does it absolutely need like a surgery or something?
You don't need surgery. So Yes, it can be reduced or improved with pelvic floor or with PT in general, just exercise. It doesn't happen overnight. It takes a long time, but you have to be willing to stick with it. There's definitely exercises there that are better than others, but it's definitely resolvable. I always say I'm going off of comfort and confidence of my patients, not so much on that physical number. We test it with a finger test. That finger number might not change, but it might. There's just no research on that. But that doesn't mean that you can't feel better about your post-baby body.
Yeah, I would agree. And one thing that I tell my patients too, and this is like literally the hardest thing to do, is be patient, because there are a lot of different factors that play into, you know, the reduction of diastasis, one of which is breastfeeding. And so obviously after you have a baby, you know, people breastfeed for however long they want to, right? This is by no means telling you to stop breastfeeding. But when you do, there are certain hormones circulating in your body, and this actually affects the integrity of your connective tissue, one of which attaches the two sides of the abdominal wall. And so as you continue breastfeeding, it kind of, you know, like prolongs that, I guess you could say. So once you stop breastfeeding, and you do that whenever you feel like you're ready to do that, that may actually contribute to some closure of the gap.
That's great to know. Thank you. A question that came up about, a couple of questions that came up on this, honestly, was like, why would someone have pain with passing solids during defecation, even if they don't have constipation?
That's a great question. I think there are a lot of factors that could go into this. I think I'd be curious to know the past medical history for, you know, this patient. I think it might be more case specific than general recommendations.
Sure.
Like it could be hemorrhoids, it could be you have a digestive issue, you have, you know, some sort of allergy like lactose intolerance, something like that, that actually can be painful to pass the bowel movement. But I'd really have to know a little bit more to suggest something. I don't know, Devon, do you have any comments on that?
Yeah, I agree. That's very specific.
Okay, that's great to know, because then obviously, like, it's good to know kind of, okay, what do I need to ask more questions of a medical provider or people like you, versus what can we just like know generically or like address on our own. I think that's awesome. Questions came up about pelvic floor and low back pain, and the idea of how is it related, if it is at all. How do you know if the pain's coming from the pelvic floor or the low back? And I know this is a bunch of questions, but can pelvic floor exercises help with low back pain? Like, I guess, can you guys address those things together?
Yeah, so they definitely do go together. Typically what we'll do in the clinic, if someone's being treated for their low back and not getting better, it's a nice segue, a nice bridge to say, it's pelvic floor. And that's also due to say that there might be other stuff going on that's a little bit more obvious pelvic floor, but it definitely can go together. Obviously not everybody fits into that category of low back pain, pelvic floor, but they do tie in, especially if there's some pelvic floor weakness and the back is working a little bit more in overtime. So it's something that can definitely be looked at the very least, to either rule in or rule out.
Another thing that can cause back pain is prolapse. I know I keep talking about prolapse, but
that's my next question. So you're jumping the gun.
So with prolapse, actually, one of the characteristic symptoms is this like heaviness drawing down in the vaginal wall, but also sometimes in the low back. And so if you think you might have prolapse, like this might kind of go together with your low back pain, especially if it's feeling like this heaviness drawing down feeling. And then another thing that tends to happen, and this happens also with some hip pain and hip issues, is that sometimes the pelvic floor just kind of decides to like chip in and help out on stabilization of some joints, or you know, if you're having low back pain or whatever. And sometimes the pelvic floor actually does a little too much and the rest of your muscles don't do enough. And so working with a pelvic floor physical therapist, you can learn how to coordinate your pelvic floor with the other muscles. So maybe the pelvic floor needs to actually relax a bit and the other muscles need to kind of turn on a little bit.
That's great. What, I guess in terms of I'm going to ask you a question about prolapse. I'm going to ask two. I guess, how would people go about, like, do they need to see a medical provider for that? Can they see you for that kind of diagnosis? But who do people have to go to first if they think that they have those symptoms?
They can see a physical therapist first. Typically, if I see a patient and I'm the first person to diagnose prolapse, I'm going to assess the grade. So if it's a pretty mild grade, so like grade 1, grade 2, and maybe even like borderline grade 3, we can work on some conservative pelvic floor PT methods to hopefully reduce the prolapse as well as strengthen the pelvic floor. If it's more severe, or if it's something that with conservative methods alone, they're not getting as much better as I thought that they would, then I would refer them out maybe to a urogynecologist and see if there are some further interventions, and there are steps before surgery, but other interventions that they can, that will help them.
Great, that's awesome. So we have, just to address the group, we have a couple more questions. We might go a couple minutes over past 5, but I'd love to get to as many of these as we can. So hang in there, guys. We got a couple more. So another question that came in about prolapse was, can exercise help it? Which I feel like you kind of addressed some of that. And can you have a baby if you've been diagnosed with prolapse? And what's the outlook there?
Yes, 100%. Same with diastasis as well. There's no reason not to. And not all prolapses, even if you are diagnosed, does not cause symptoms. Some people have a very minimal grade and they have significant symptoms, and other people have the opposite. They have a higher grade and no symptoms. So that can definitely, just play into it as well. But in terms of exercise, it can definitely be improved. So if you are having that heaviness or pressure, exercise does help to reduce that.
Awesome.
Yeah. I would say it does depend on what exercise you want to do. Let's say you want to get back into running. I would not just go ahead and start running. I would say, work on some exercises that will help to strengthen your core, your glutes, your pelvic floor before you get into that. So a lot of these exercises are kind of like horizontal first, right, within the plane of gravity, because gravity does worsen the prolapse. So going, that way first, and then progressing into more vertical exercises.
That's great. That's awesome. Okay, so another question that came in is, what advice would you give to somebody who just had a baby who's suffering from bowel incontinence, but maybe also just address bowel incontinence in general too?
Devon, you want to take it away? You kind of had one like this.
Sure. So whether you're postpartum or not, it's basically the same treatment. You are probably suffering from your pelvic floor not being as coordinated enough or as strong enough to maintain those bowels, to maintain continence. So with that, we want you to make sure you're doing those posterior or external anal sphincter focused Kegels, as long as they're pain-free, of course. So you can do those quick flicks to kind of get the coordination component going, just to make sure that your brain and your pelvic floor are in tune with each other. But you also want to work on those long holds as well, those endurance holds, to make sure that you're able to hold it in so there's no leakage. So we always recommend starting small, like 5-second holds, and then working your way up to those longer holds, because those muscles should be able to work throughout the day at all times. So we'll stop you at like 30 seconds holds typically, especially for bowel movements. But that should help to reduce some of that incontinence.
Awesome. Thank you, Devon. We have one more question we're going to get to. This one is a little bit more generic, but can pelvic or pubic area pain be caused by certain things like posture, sitting too much, wrong movements? And how do people go about figuring out what the reason is for their pain?
Want to take it, Jessie?
Sure. Yeah, that's a good question. Definitely very general. I would say pubic pain, like at the pubic bone, sounds a little bit more insidious than just sitting the wrong way or moving the wrong way. Typically, we'll see this in, women most of the time who've been pregnant or given birth because of relaxin and also just your pelvic expanding and shifting, to accommodate for the baby. But you can certainly have pelvic pain from sitting too much. We see pelvic pain a lot in cyclists from sitting on a seat. if you're sitting poorly on your sacrum or like your near your tailbone, right, that puts a lot of pressure on your pelvic floor as well as the nerves surrounding the pelvic floor. So yes, the answer is yes. I would say you could likely, if you were just feeling generalized pain, you could probably see any physical therapist, and if they felt like you needed pelvic PT, you know, you could see a pelvic floor physical therapist. They would be qualified enough to make that recommendation.
Okay, great. That's awesome, guys. This was super, super helpful. You guys did a great job. It was very informative. I really appreciate it. We hope that today's talk was valuable for all of you and that you learned a few ways to prevent and perhaps manage some of your symptoms that you may be experiencing, as well as better understand the pelvic floor in general. If we didn't get to your question, we apologize. We will do our best to reach out to you directly afterward. We'll also be sending out a handout of the exercises we covered and the important facts for you to have as a reference. And just as a reminder, as an outpatient orthopedic physical therapy practice, we treat an array of conditions from head to toe, and we're open for in-person visits as well as telehealth sessions. You can do either for pelvic floor physical therapy. Our pelvic health therapists are available for telehealth and in person. So it's really based on your comfort of what you prefer. Should you feel that you could benefit from some individualized guidance or treatment after today's talk, please don't hesitate to reach out to any of us individually, and we'll personally coordinate and help you get set up with an appointment. Thank you all again for spending time with us today. We really hope you enjoyed our webinar. We wish you all the best. Be well, everybody. Thank you.
Thanks, everyone.
Thank you.